So the other day I was in Fashion Island with my kids and my wife, and we were at Lululemon of all places because I needed a new workout shirt. And I was walking down the little knick-knack session, and there was like this very attractive woman walking towards me, and she had her hat down, and I was like looking over at her, and she like kind of caught me, and I was really caught off guard. And then to make matters worse, she kind of flipped her hat up and said, "Hey, Dr. Zelken," and my heart sunk because I was like, I just got caught by somebody who knows me. It was awful, and it was Francine. So Francine is a very, very important part of this community. People who watch my YouTube are kind of all over the nation and even the world, but in Newport Beach, California, Francine offers non-surgical solutions to the face that match, at least temporarily, the results that I can achieve with a deep plane facelift. And a lot of you have been asking questions like, can I get perioral mound reduction with threads? And we offer threads at our office, but as many of you know, we don't necessarily promote them. And so when I looked and I reached out to Francine and said it was nice to see you, I looked at some of the results she was achieving, and I was so sort of taken aback by how good they were. And we'll feature some of these results for you to see what you can achieve, at least in the short term, at least, if not more. We'll get into that with threads. And I feel that I have a lot to learn from Francine, and I feel that a lot of your questions about non-surgical solutions for the mid-face can be addressed. So without further ado, I want to introduce Francine Young, Queen of Threads of Newport Beach. And if you can just maybe tell us about everything that is threads and maybe show us, that would be super helpful.
Definitely. Yes, we did meet at Lululemon and he did not recognize me, so I will. No.
Now, I did when she said her name. I was like, oh yes.
I have been doing threads probably for over 8 years, and as many of you may know or not know, threads are sutures. So they're sutures that lift the superficial fat pads. So I thought it was really interesting when you invited me on to discuss sort of facelift versus thread lift, because I get asked that all the time. When do you do a facelift? When do you do a thread lift? Where does Botox and filler fall into all of this? And they're really great questions. And I think we're gonna make that really clear, and we're gonna kind of talk about a controversial topic, which is, do threads cause scar tissue? That's the big one, right? So I'm really excited to discuss this. I'm excited to talk about vector design. I'm excited to talk about what these sutures are. What are threads?
Let's start with that. Can you show us what this thread is?
So these are PDO threads. And so what they are is they're loaded onto a cannula, okay? So you can see that. And what you do is, I'll pull this out for you. You can see that they're textured. So we'll pull them out from the other side. So what I would normally do, correct.
So you can't go too deep?
No. Well, I mean, I'd really have to try. I'd really have to stab you a bit. Yes, you could.
You should not go too deep.
You should not do. You should be in the sub-Q, superficial fat pads. And so what this does is, as I put this in the fat pad and then I withdraw, the little stopper comes off, and then the thread is left.
But the stopper stays in the face?
No. That comes off,
okay.
Right? So as I push, so basically as I push this cannula in, this stopper starts to go up.
Okay, so this is hooking on with these reverse barbs to a superficial fat pad where you're trying to lift.
Exactly.
And then you pull it up mechanically, and how do you get the tension that you want? Where does this stick on the other end? These things are facing the other way.
So you feel this grab. Shit.
Can you bleep that out, please?
You can feel that grab. So I'm pulling.
Yeah, you can move my hand with that.
Yes, definitely.
Okay.
So using different techniques such as reverse vectors, traditional vectors, I can make a mesh in your face. So imagine 30 of these in different orientations in your face, just lifting the fat pad.
I feel uplifted, I feel rested. I feel like I'm not trying to constantly smile to get my mid-face up. That's how this works. But you say mesh, you've said mesh a few times. Is it literally like a 90-degree grid pattern?
I can crisscross, and we'll talk more about vector design as we kind of compare and contrast how you would do a facelift as opposed to how I would vector design a thread lift for someone's face.
Okay, so that answers my question as a surgeon. How does this fixate it? Because my job as a surgeon is partially to fixate a stitch onto something, pull something, and sew it to something. You're saying that this does it the same way.
So the fixation is all along the girth of the thread, and also when I go back up here, what we call the DTF, deep temporal fascia, I can go ahead and anchor these threads.
Okay.
So I can apply them both traditionally, this is what we call a traditional vector, in your face.
Okay.
And I hook it onto the fat pad.
Okay.
Then I can turn around, flip it, and connect it to the DTF.
Okay. And you know you're getting purchase on this fascia?
Correct. I've been
Okay.
in the cadaver lab. I'm always spot on where I am.
I believe it.
I've dissected, I've made sure. And as you know, in that plane, it really catches. It's this tight compartment.
Yeah.
So it will really catch. So just imagine, I always tell, when I'm teaching, I always tell the practitioners, think about a bungee cord and you're up on the bridge. Your DTF is the stopper, the hold. And this is, yes, free floating, but if I have a portion that's anchored, that's what we call it, anchored, it won't move.
Yeah, these called cones. What are these things called?
Correct. So they're barbed throughout the entire length of the thread.
Just look at the
and
difference.
they catch. They're almost like little fish hooks.
This is my surgical stitch.
Is this a
equivalent.
1-0?
This is a 3-0, and it has little barbs too.
Okay, let's feel them. But you can
But it's
see
nothing
It's
compared
not
to yours.
as, feel mine, how intense it is.
Yeah, I mean, you can
I
like
could actually,
rip my skin open.
yes, I could.
Okay, and we're going to talk about that too.
Okay.
So this is what I use. This is called a Stratafix suture. I use it in mid-facial plication, and this is enough. I kid you not. This is enough. I don't know if you can get it on film. You can't even see the barbs. This is enough to not pull back against deeper structure. So I'm a believer. Okay. What are the types of threads? So these are cones. This is a PDO thread. Do we use permanent threads anymore?
No, that has
That's old-fashioned. We're done.
completely fallen out of favor.
Good.
And I'll tell you why. For the other reasons that we were talking about on our IG Live is that when you do a facial implant, if you're not screwing it in, locking it down, however you're doing it and fixating it, it can move. So we don't want threads free floating in our face because we have so many mimetic muscles in the front part of our face. Moving and animation can be a problem, and that's what we were seeing. We were seeing improper placement, and we were also seeing over time implants move.
So threads don't necessarily give us this sort of puckered look that we all see and we're all afraid of. We all have those Instagram
Sure.
or viral photos that actually malign our practices. I do for buccal fat, I do for facelift. You probably have this one that everyone's afraid of with the brow lift. You know what I'm talking about.
Yes,
We've all seen it.
Definitely.
Okay, so this is the real question though. I've already flattered you at the beginning of the video. How many threads do you have in your face right now?
Oh gosh, the joke in my office is when I die, I'll be nothing but threads.
Okay, but do you have 100 threads in your face?
I've been doing it for the past 8 years. So
Okay.
easy once a year, maybe, 15 to 30 threads. So, you do the math.
Yeah, that's crazy. And I can't say a single one, you look very natural. Can you show us these other smooth threads? These fascinate me. So threads are not all about lifting. There's also this component of actually like volumizing the face. So what I do know about threads, because we are trained in offering them, is that it creates scar tissue around the thread itself to create this channel of collagen. But for people who don't want to lift and just want that collagen, there is an alternative. And that alternative is?
Smooth threads or mono threads. That's the other nomenclature for it. So when we're talking about smooth threads, I liken it, if you can see, you see that little, these are PDO threads. They don't have any texture to them. Sometimes they come in a little corkscrew that just allows you to have a little more volume. So imagine 50, 25 of these threads in a particular area of the face, and it's going to build collagen, type 1 and type 3 collagen. So I use this in 2 ways. One of the things I really hate, and I think most women will agree with me, is when you're applying your makeup and you see these little annoying lines.
I get it
see
all
a
the
couple
time.
of lines
I
right
know. And it's not buccal fat removal that did it. I'm 44 years old.
So I technically could put these little threads, they're loaded on a needle, okay? Same ideology as the barb thread, but obviously on a much smaller scale. And I just would implant that in the crease itself, and over time.
So these are micro implants.
Correct.
So I love the idea of sculpture. This is the same thing, but you can control it without migration.
Correct, and you can design it. So sculpture, when you think about sculpture, placing it in the face, it's like seeding a garden. So I put it in, however it grows, it grows. I can really direct this. Okay. So if I want just a few in these little lines, if I feel like someone has a little bit of fluffiness right here or in the submentum, I could do a little hashtag, put it in the fat pad, it'll cause a little bit of fibrosis and cause that fat pad to sit down a little bit better.
That makes a lot of sense.
A lot of different things that we can do. It's kind of the same idea. I was talking to another plastic surgeon. He was saying it's kind of the same idea when they're doing eye surgery and they do a CO2. They're really trying to get that skin to mat down. One of the other things that I think is very interesting about PDO Threads is it actually throws out these little collagen, and it binds the surface of the skin down to near the superficial fat pad. So it actually will tighten. You get this kind of shrink wrap effect, which is really nice. We call it like a Spider-Man effect. It just goes and shoots out a little collagen and just kind of brings all the layers kind of together. So I can see and this might be a segue, but I can see how it might be a problem in a facelift if it's in the wrong plane. So that's really where the big hubbub is are you in the right place? And that's with anything. That's with filler. If you have filler in the wrong place, if you have it in the muscle, it's an issue. You can have nodules. If you put your neurotoxin in the wrong place, you have a terrible droopy eye. If you do a facelift and you cut a nerve, it's a problem. So everything has its proper place, proper plane, and needs to be done by someone who really knows what they're doing.
That's great. So just like any technique, we've had YouTube videos before about face tight having a 1/3 positive rating on real self. Is it face tight or is it the surgeon that's doing face tight? And I would say the same thing about threads based on what I'm hearing. And I'm inspired by the work that you have achieved, the product that you've achieved. I have some questions about how much of this is swelling because of like putting numbing medication in, but we'll get to that. Right now, what I want to do is a little fun show and tell session. I want to go to the lab and I want to see if I gave Francine, I'm sorry about that, 10 of these threads, and I said, or 9, we'll say 8 or 9 threads, and I want a facelift. Can you draw where they would start and finish? I want to see what her results would be like versus my results, where I would put sutures in a deep plane composite facelift, and then we can compare and contrast the difference. So
bring it on.
Without further ado, let's go. If I had 1, 2, 3, 4, 5, 6, 7, 8 sutures in the deep plane composite facelift and neck lift, where would they go? One would go here to raise this up and out. And I'm being quiet because I don't want Francine to listen. I hear her laughing, she can hear me. The second one would be right here specifically to lift this part of my midface. And as we work our way down, it's to become progressively, okay, so these would be the 6 that I would do in my midface. This would be to eliminate the jowl, and as I work my way up, it becomes progressively more of a vertical pull. Okay, in the neck, I would probably put not 1, but 2 sutures from the corner of my platysma backward to suspend it this way after releasing the platysma from this mass. So get used to these little whiskers because we're going to compare and contrast where Francine would put threads in my face. Take the honors. I'm not letting you see what I've done. You can look. I can't see anything. Take your time.
Okay. So he's thrown the gauntlet down. He's challenged me. Okay.
8 lines.
You don't copy me, okay? He said, don't copy him. You don't copy me. So if I had 8 threads, only 8 threads. Now, normally on a full face, I would do 30 threads. But if I only had 8, here's what I would do. I would take from the lateral canthus, now, female aesthetics and male aesthetics are different, obviously. So I'm gonna be slightly more horizontal than vertical. So I'm gonna start still on the zygomatic arch, and I'm gonna drop a line all the way to the top of his nasolabial fold. I have 8 to play with. So is that for both face or just one side?
One side.
Okay, perfect.
16 total.
Fantastic. So I'm gonna do 4 here, and I'm gonna completely pick up the nasolabial fold. So you can see as I bisect the nasolabial fold, I'm gonna drop 3 lines here. My 4th line is actually gonna come, usually patients have a jowl. So I'm gonna pick up the top portion of his jowl, which is non-existent. And then I'm gonna actually reverse those vectors up. You can't draw, but everything will go upward in the DTF, deep temporal fascia. And then I'm gonna come behind the ear. I'm gonna pick up the ear lobule, and right behind here, I'm gonna start my port, and I'm actually gonna drop 4 lines here. So that's a total of 8. So I'm gonna completely cradle that jawline and lift the mid face.
You're gonna get me neck elevation by doing this?
Yes.
Okay.
Now, not the entire neck, but a good portion.
I'll give you one more stitch because I want my entire neck. One more stitch.
So if I were doing 1 more, can I have 2 more?
Yes. Yes.
I would come directly under here and start my opening and then come back and reverse. And that'll help catch some of the fullness that's right there. And because I've already cradled with the 4 here, so most of the heaviness is taken. Sometimes patients just have a little extra skin, so if you just go directly right there, you can really pull up that
All right,
nicely.
I'm feeling a Jackson Pollock painting on the side of my face. I'm starting to regret my decision. So now it's time to compare and contrast, okay? All right. You know what? Not too different.
Not too different. And
All
just
right.
longer.
So let's talk about this. Let's do a deep dive real quickly. So my rationale in a facelift is I used to liposuction the jowls, but now I think that resuspending it posteriorly is really attractive. And as I go up on the face, it becomes slightly more vertical as I go. So I get sort of almost a trapezoidal lift this way. I agree with you. In a male brow, you want it out, not up. And so this would be my vector of pull. I would divide this mass from lymphedema, and I would pull this back. What I've noticed that you've done with this side of my face is you've converged everything, just suspended on the deep temporal fascia. So you're
Correct.
really focusing 4 of your 8 stitches on my mid-facelift.
Correct.
And I think that's an artistically smart move because for my face, my nasolabial fold is my worst feature. But
And it also allows me to suspend the mid-face. So if we have a fat pad that's a little bit ptotic, or you have a nice distance between the lid cheek junction, it allows me to actually lift this portion to fill in some of that lid cheek junction.
So you have like a pulley almost in your mid-face.
Correct, because I will actually externalize that thread and give a little tie, and then come back up and then DTF.
So these stitches are almost identical, and these are almost identical. Right. I go parallel here, you converge here. We have the same aesthetic. So that's a really important point. Can we go back to the conversation room?
Yes.
So it was really fascinating to see the vectors of pull, and mine aren't exactly how I do it. It's harder to mark myself than to mark a patient, but essentially the idea is to go parallel but slightly more vertical as I go. What I've noticed with Francine's markings is she did the same exact management of the neck, brow, and jowl as I did, but she converged onto a certain point into some stout fascia in the temple for the midface. That's great. I understand why she's doing what she's doing. So we have the same aesthetic and the same mission. Then what distinguishes a facelift from a thread lift?
I think it's really important to ask the patient what are their expectations. So if they expect something to last 5 to 10 years, they should have a facelift. If they expect something to last for about a year, they should have a thread lift. And also, how heavy is that patient? Do they have a really heavy jowl? Do they have a really heavy neck? They definitely are surgical candidates. You have to delineate who is a surgical candidate and who's a thread lift candidate. A thread lift candidate is someone who's not quite ready to go under the knife, but they know that fillers and Botox aren't quite doing what they want it to do, and lasers aren't quite managing them, and they want a little lift because fillers and Botox don't lift, lasers don't lift. So if they want just a little reapproximation of the superficial fat pads, typically within the nasolabial fold fat compartment and the jowl fat compartment, if you want a little elevation on that, that's the perfect candidate for a thread lift.
Do you weed out your patients? Do you say if you're can you sense if they're unrealistic?
I definitely will ask them, what are your expectations? And like I said, if they start talking about a timeline of 5 to 10 years, then they need to have a facelift. Okay. If their expectations are, I want this to last a really long time and I really want this to be sort of permanent, they're not the best candidate for a thread lift. And I would definitely refer them to someone like you if that was their expectation.
Okay, and I appreciate that. I think when it comes down to it, one of the biggest advances in the facelift in the past 10 years, not 50 years, but 10 years, is this wide adoption of a composite deep plane facelift, where we get in underneath the hood, real deep, right next to the facial nerves, and release ligaments. And if you don't release ligaments, you don't get that lift. If we don't get that lift, then we're closing things under tension. If we close things under tension, we get wide scars and breakdown. With a thread lift, you cannot release any of these ligaments. Do you think that that is one of the biggest limiting factors of the thread lift?
Definitely. It's interesting because many times, if you look in Korea, they will typically do a thread lift with a facelift, because you can make some vector designs with threads that you can't with a facelift. There's some limitations, if I understand right, with a facelift. It's either the ear or in the temple. There's certain vectors that I can do that you might not be able to do, where I can just catch a little bit more of that nasolabial fold.
Too, right?
Correct. But you don't. A good surgeon's not going to really, sweep you back to make you look windswept. But sometimes it might be a little too conservative. So you might want to go in with a thread lift and just purchase a little bit more of that superficial fat pad.
And I know there's surgeons who advocate this. Julius Few is one of them, of doing a thread lift at the time of the facelift. It's something I've never adopted only because I'm satisfied with the results of a facelift. But I am getting more and more turned on to the idea of threads in my practice because of the work that you've produced. Now, the pictures that you sent me are really good, and I know that all of us as providers will sometimes feature our best work, but if these are truly representative of what a facelift or a thread lift can achieve, then I think the results that you're achieving are on par with what I'm achieving in the younger population in particular. What I do see also is a lot of volume. The volume that you see, do you think that is partially like numbing related, or is that truly?
I actually in total in face, I probably use about 5 cc's of numbing. That's
Total,
not a lot.
face.
That's in the DTF, that's in the mid face, that's
Unbelievable.
in the jawline. So,
Compared to up to 80 cc's of fat grafting during a facelift. So that's really not
so
that
what
much.
you're actually seeing is the patient's own fat volumizing them. So that's why I say, if patients say, okay, when do I do fillers, when do I do a thread lift? I would say do your thread lift first, because I'll actually be able to volumize you with your own ptotic fat and just lift it in a better position, and then put in the filler. Usually it's in the piriformis and the temple. Those are the areas where you have more of a concavity. So that's where you would put it or marionette.
Okay. Second to last question.
Yes.
I know we're going to get to the last question. I know you have one for me too.
Yes.
Second to last question for you. My audience is interested in perioral management. They're interested in these downward turned corners of the mouth. In Korea, they're doing muscle reattachment and things like that. In the States, that hasn't gained steam yet. It just doesn't work well enough in our collective experience. Everyone's asking about threadless. I do perioral liposuction. I do buccinated mucosal. It's a muscle excision and repair, and I do facelift. Tell me about your experience with threads for perioral mounds specifically.
I think it's a difficult area to treat. So, and I think you have to sort of understand what the causation is. So if you just have a lot of, for lack of a better word, floppy skin, you really sort of need to reapproximate that skin in those superficial fat pads, correct? If you have a deficit, that's a time where you would want to either put fat or you'd want to put a filler in that area. Perhaps you need a really good neurotoxin on the lower half. You have a lot of DAO pull down muscles that are constantly pulling this area down. So it might be a combination of that threads, it might be a combination of buccal fat, it might be a combination of using some fillers and some good neurotoxin. It's probably not a one size fits all. And then maybe on top of that, you use something like a radiofrequency microneedling to where you're making that skin a bit tighter and it wraps around a little bit better.
Okay, that is interesting. And I'm gonna ask now the last question, and you're not gonna like it, because every plastic surgeon bitches and moans about not only biological injectables, not only fillers, but particularly threads. It's like when we're under there, we're looking at guitar strings sometimes. We're looking at fibrosis. We're looking at things like that. What are your thoughts?
I think that we have to be really clear on what we're talking about. Are we discussing the fact that will threads hinder you from having a facelift? Here's the rule of thumb. If you're going to have a thread lift and you know you're going to have a facelift at some point, wait 1 year. Have all the threads wash out. They're dissolvable.
Okay.
So have them completely wash out. My other question to you, which I think kind of answers the question about scar tissue, is, would you ever do a secondary facelift?
Yes.
Why do you think I ask you that question?
Because it's probably a lot harder to do a secondary facelift than a primary facelift after
Why?
threads. Because when we elevate tissues in a facelift, we create full thickness planes of scar tissue. When you do a facelift after threads, at most you're getting these little channels, little bullet holes every now and then. And so you're talking about apples versus oranges.
Correct.
Offline, Francine and I sort of joked about this. I have never turned away a patient because he or she had threads. And I have seen permanent threads from back in the day, and it's literally looking like a meshwork, and these threads are running right along the path of facial nerves. And in a more recent case, I noticed that a woman who had threads for the past 6 years literally had tatters to her SMAS. But guess what? We find a solution for it, and it's not that hard to do. It makes it harder, but not impossible. So thread lifts do not contraindicate in any way a facelift in the future, and I think it should be very clear that everybody understands that once you get threads, it doesn't condemn you to a life of not being able to get a facelift if and when you want it. Which brings me to my next question. What's your end point? When somebody gets threads 7 times and is not getting, do you keep going? What do you?
I think that's really
enough?
I think that's really up to the patient. I mean, I will definitely recommend, hey, I think your money is better spent by having a facelift, something more permanent, and then you come back and we do lasers and we do some other things. But I think it's really up to the patient. You have some patients who just cannot go under general anesthesia, or who just don't, they don't want the scar, or for whatever reason they can't take the downtime. So there's a lot of different reasons why people don't want. I know that it's a very small percentage of those that will actually do surgery. So I think for those that do not want surgery for whatever reason, I think they should have some options.
Okay, and so I would like to close this conversation by saying that my opinion about threads remains neutral. We offer them in our practice, and I think there's a role for them. You've opened my mind today, because things like tech neck and perioral mounts, or perioral rhytids, things that like Bellotero and other watery fillers just by definition cannot fill. They'll follow a path of least resistance. This is a great opportunity. I wasn't even aware that this was a possibility, and I thank you. But you said something else, because when I talked about that SMAS and that recent facelift kind of being tattered, what I really needed to grab onto had been grabbed onto a lot in the past. You brought up a really good point. You said that means the injector, or that means the provider that performed the thread lift went too deep.
Correct.
And I think if I could conclude, you can make concluding points too. If I could make any conclusions, I think there's a very strong and growing role for threads in plastic surgery. I don't think it precludes somebody from getting a facelift in the future. It might make it a little bit harder, but no plastic surgeon will ever turn you down. It's a great way to try things on for size at the least, because the results you're achieving, even in the short term, are remarkable. But the big but here is that it needs to be done by a skilled provider, and there's just not that many of them. And so Francine is a little gem, a little queen of threads in our community, but you've got to do your groundwork to find somebody who is on her level, if she's not available to you, to do the same for you. And then in that case, I think that threads have a very strong and powerful potential, not only in facial rejuvenation, but also beautification.
Definitely. It was a pleasure, and I had a lot of fun.
All right, well, I learned a lot too. Thanks. I hope this answered your questions. You guys have been asking a lot about threads over the past 7 years. If you have any additional questions about thread lifts or have any comments, please comment below. Be sure to turn the notifications on and subscribe to our channel. Thanks so much for watching.